Yeah, so with LASIK, you're basically creating a little flap which you lift like a trapdoor.
Yeah.
Then the treatment that you do, so if it's a treatment for, say, if you're short-sighted or myopic, the treatment will flatten the surface centrally. And if you're long-sighted or hyperopic, the treatment will flatten the surface peripherally, so you'll get steeper in the center. So it just does different things depending on your script. And then the little trapdoor goes back down. In Smile, the laser makes that tiny little cut in the cornea, and then it actually, the single laser, so just the VisuMax 800, creates that disc that I was talking about. Then we remove that disc,
Yeah.
and then that area just settles down and you're just left with that small cut. So it's quite different technically, and it's different for the surgeon. It's a very different procedure, but with actually the same end outcomes. Now, ZEISS celebrated earlier in the year, they've done 10 million Smile cases worldwide. So even though we're talking about a newer procedure, it's not by any means as a, it's not new. It's been heavily used, so it's extremely safe. Like, you've got 10 million eyes of data there. So it's just as reliable and safe as LASIK. And there's pros and cons to both, which I'm sure we'll touch on later on in the discussion.
Yeah. Yeah. So SMILE, of course, stands for small incision lens extraction, doesn't it? So it's, yeah.
Lenticule, not lens, because
Oh,
it's
sorry.
a lenticule. Yeah.
My
So
mistake. Yes.
the L is lenticule because what lenticule is just a fancy name for that disc that I keep talking about. So yeah, so that's what SMILE stands for. And then there's other types of procedures that have they're similar to Smile. So that Smile is trademarked for ZEISS, so you can only use Smile or Smile Pro, which is what we have, if you have ZEISS lasers. So that's trademarked to that company. Then different companies have similar procedures. So again, they're lenticule or disc based. They have slightly different technologies and slightly different ways that it's done, but it's all called kind of lenticule extraction surgery. So Smile specific for ZEISS, and then you've got Silk, and you've got a few others. So it gets very confusing for patients because there's lots of different terminology. But really, all you need to know is that lots of different lasers are on the market. They all have different pros and cons. There's lots of different companies. But Smile with ZEISS compared to other companies, my understanding is it's had by far the most procedures done globally for lenticular extraction surgery. So as I said, 10 million, whereas some of the other companies haven't reached that because Smile has actually been around. ZEISS was the first company that came up with that lenticular extraction surgery. But like everything, there's lots of different options for patients, and we're always happy to chat to patients about. I have lots of patients come and ask me questions about all the different names and all the different procedures and all the different lasers. And I think it's important for surgeons like myself to be up to date with all the different companies and what's on the market because there's a lot of crossover. And at the end of the day, a lot of the outcomes are very similar in terms of whether it's flat based or lenticular based.